Hello and welcome to Section 4, the transitioning back to work phase of the LTD journey. Just to recap, in the previous sections we introduced you to the LTD journey, we shared some information about the various professionals who might be involved with your case, and covered the top 5 questions that are typically asked during the process and what the expectations are of your insurer. In this section, we will cover what happens when you start to feel better and how the various professionals get involved with your return to work. This section is very important and will address how transitioning back to work can either go smoothly or become potentially more of a challenging process. Lots of content to cover in this section, so let's get started. Although many cancer patients worry about the transition back to work, and for good reasons considering the stress of leaving work and going through treatment, the vast majority of LTD claimants, or those receiving LTD, actually return to work relatively smoothly. There are, however, a smaller percentage of folks who have a more challenging journey to return to work. Let's talk first about the smoother transition. On a typical LTD journey, most LTD recipients have a period of not being well when they are in treatment. This is the hard part of the journey. But as your treatments start to end and you're starting to feel a bit better, you are recovering and starting on the path to better health. But you will not be staying on LTD, long-term disability benefits, until you feel 100%. It is likely that the insurer will want you to start preparing to return to work, possibly on a graduated return to work, or GRTW, when you may only be feeling 50% better. There are reasons for why you never stay on LTD benefits until you feel 100% better, and we will explore those in the next couple of minutes. One way to sum this up is from a statement I once heard from a consulting physician. He said, "The patient may or may never be 100% better, but at this point in time, they are well enough to try working." As you begin to recover, the claims specialist will begin exploring what is needed in order for you to return to work. Let's explore what each of those options are and how the professionals involved or your activities play a part in your journey in returning to work. The claims specialist will seek updated medical information from any professional that is treating you. However, the information the claims specialist is looking for will be more specific, more detailed, and more related to your employment. They will ask about updated reports, what treatments are still pending, how you are healing, and other things you're doing to recover, like exercise and sleep. Consider this a very comprehensive review of your medical case to ensure the insurer has a complete picture of how able you will be in the near future to begin your return to work journey. Several times I've mentioned that the insurer is seeking objective medical information, the kinds of concrete medical facts that can be measured. I refer to this as just the facts. On the medical reports and when the insurance company speaks to your treating physicians, they are seeking information related to impairments and corresponding functional limitations. If we consider Nora, we know that she has undergone surgery, chemo, and radiation. Her impairments would relate to these treatments, such as a surgical wound, radiation burns and heat around the radiation site, diminished food intake, weight loss, food aversions, brain fog, and diminished physical stamina. All of this is very concrete and specific medical information. Functional limitations are how the limitations are impacting the person, how the person is limited in their ability to function as a result of the treatment. Nora's functional limitations could be dietary limitations due to her inflamed digestive process, causing her to be unable to eat solid foods for several weeks and have trouble keeping food down. Nora is also experiencing extreme fatigue, nausea, inability to climb more than 10 stairs at a time, unable to carry anything above 5 pounds due to the surgical wound, is anxious about going out in public because of her bowel worries, and has brain fog that manifests itself with impaired memory, meaning she cannot find the right words and has trouble multitasking. So it's important to think in terms similar to your physician. What are your impairments? And in concrete ways, explain how you are limited to function because of them. Earlier in this section, we had discussed the typical process of starting to return to work and why this happens well before someone feels 100% better. This often comes as a surprise to so many people. Why does the insurer want me to go back to work when I don't feel fully recovered? Well, there are several reasons why the claims specialist and vocational rehab counselor will want to start as soon as possible. Let me go through some of the reasons. We know all along that the insurer has been gathering medical information and that the claims specialist can utilize the expertise of the consulting physician for input and advice. Based on all the information the insurer has, he or she may determine you are able to start returning to work soon. There may never be a point where you feel 100% better, or you may never regain your health to 100%. Often people are not feeling 100% prior to leaving work to start treatment, so the insurer will not be using that 100% better as a benchmark for returning. The belief is that if you are feeling a bit better, then you can work a bit. We know there are many emotional and personal reasons as to why going back to work is good for your health. You'll be back among your peers, back to a regular routine. Busy hands at work keeps the mind occupied and not thinking about your worries. But by far, the best way of learning how well you can manage at work is by being at work, testing your abilities in a real setting rather than trying to forecast how you might be able to perform. The voc rehab professional understands that you aren't totally well. They've met with you and learned about your limitations and abilities. But by having you in the workplace, doing elements of your job, the voc rehab professional will have real information to evaluate your progress and know how well you are able to manage. The longer you stay away from work, the more you lose your attachment to work. All along, the claims specialist had kept work on the horizon, so you didn't lose that attachment to your job and your employer. In fact, one other motto of vocational rehabilitation: when is the day the person on LTD should start thinking about going back to work? The answer is the day you leave work. We never know how capable we are until we try. In the last section, we introduced the vocational rehabilitation specialist as one of the professionals who may be involved in your case. If the claims specialist determines that vocational assistance is needed to help you with your return to work, then one will be hired to work with you. This person will gather all the information needed, meet with you to learn more about your situation, speak to your employer about your job and the many responsibilities you have, and then create a plan for your return. You might need other supports to help with that transition, or you might need certain things taken care of prior to starting a return. This will be up to the voc rehab specialist to plan out. The return plan will be presented to you and your employer for any feedback or suggestions. It will be really important for you to give feedback to the return plan. Things that you know about yourself and your job that will be important to consider for your return. Then, the voc rehab specialist will activate that plan with you and monitor how you are doing, keeping in touch with you and your employer. If problems arise with your return, the voc rehab specialist is your resource expert to help deal with those challenges. The independent medical examiner, who was also introduced earlier, may be called upon at this time as well. After a meeting with you, the IME will submit a report to the insurance company and may offer some concrete suggestions on what you can and cannot do if you are returning to work. Not every person on LTD will see an IME. In fact, usually only a small percentage ever see one. There are many LTD recipients who wonder, my doctor says I can't return to work for the next 6 months. Why does the insurer want me to return now? Parallel to this is the thought, you ask for my doctor's opinion and then you don't follow it. Or my doctor knows me better than you do. Your physician is to supply concrete information, and the insurer will determine what they think the next steps are based on their own assessment and commentary from the consulting physician. And sometimes the information your physician is submitting isn't detailed or objective enough, so the insurer has to make their own determination. As well, the claims specialist may also speak directly to your physician to probe more on the medical information. You might not know that a conversation has taken place, and the outcome of the discussion may have an impact with the insurer making the decision that you have regained enough capacity to start returning to work. There may be no hard medical evidence as to why you can't just try starting at work and see how things go. At the end of the day, the insurer is responsible for making their own decision about entitlement and ongoing eligibility. It may be in disagreement with your physician or the information noted on the last medical report. or even your perception of the situation. But it is their responsibility to their company and to the employer to not keep you on a claim when you aren't fully disabled. The insurer might utilize the expertise of other professionals to learn more about your abilities and your readiness to return to work. This could be the point when you might be sent for a functional abilities assessment. They'll put you through a variety of physical and cognitive assessments to learn where your strengths and barriers lie and submit their report to the insurer. They might also have you engage with other experts such as a psychologist, psychiatrist, or physiotherapist. Your employer plays a significant part in your return to work journey. Aside from you, your boss or manager has a strong understanding of your work responsibilities, the culture of the workplace, and can give important information about how to best have you return to your job. The claims specialist or voc rehab specialist will want to speak to your employer to gain their insight. Will you be returning to a workplace that is welcoming of you or not as supportive? Has your workplace undergone significant changes since you left? Has your job changed since you left? What are the key responsibilities of your job? How do your abilities and limitations match to the work duties? Are there gaps in your knowledge that need to be developed either before or as part of your return, such as the need to learn a new computer program or changes in your role? These are the kind of things a professional will want to know to help prepare you and your employer for your return. The claims specialist or voc rehab professional won't be sharing any information about your cancer journey, but will be sharing specific information about your abilities and needs when you return, so that your employer is aware and everyone is working together. All that culminates with the creation of your return to work plan, and this will be shared with your employer for any feedback and their agreement to follow. And the last piece of the return to work puzzle, the most important piece, is you. Once medical information determines you have regained some capacity and the professionals are engaged as needed, you will be advised that a return to work is in your near future. A plan will be presented that builds on your skills and tries to minimize your deficits as you work towards ramping up your capacity. There are generally two ways you can return to work. The first is jumping right back in, resuming your full work schedule. This usually is suggested for folks who've been off for a shorter period of time and generally have more capacity. For those who have been off work for a longer period of time, say anything over 6 to 8 months, a graduated return is suggested. The claims specialist or voc rehab professional will create a gradual return plan that focuses on ramping up, building up your time at work, and the duties you are performing. It's all about time and work duties. Your employer will give commentary to the plan as well as yourself, and the plan can be adjusted or modified as needed when you are working through your return plan. Let's explore a typical graduated return plan next. Here's a typical schedule for a gradual return. It does not describe the work responsibilities, but those are added to create a full return plan. As you can see in this plan, the person is working half days, 3 days per week for the first 2 weeks, starting slow, nothing too demanding. On the Tuesday, more work hours are added in week 3 and 4, so the person is working 4 half days per week. In week 5 and 6, a 5th half day is added in. In weeks 7 and 8, 2 of the half days are lengthened to almost a full day, and the person is still working the half days for the other days of the week. Then by week 9, the person will be returning to work full time. A typical graduated return to work might last 4 to 12 weeks, possibly longer, and is based on the need of the person. One suggestion for you, if you know that your insurer will be suggesting you return to work gradually, you might want to draft up your own graduated return plan, thinking about the hours you can work and the work tasks you can undertake. You'll want to share this with your claims specialist or voc rehab professional to show what you think might be the best strategy for you. We've mentioned several times that it's always the goal of the insurer to return an employee to work. For some employees, depending on their health, their limitations, and the employer, this could be their previous job, possibly a modified job, a different job but with the same employer, or possibly a new employer if they're unable to return to their previous employer. Your LTD policy might have a clause that if you return to work and you're only earning a portion of your income, say 40% of your previous salary, the insurer will top up your earnings to the amount you were receiving on LTD. This might be for a specific period of time, such as a couple of weeks, or it could be for the full period of transition. It all depends on the contract. Some contracts also have a special way of calculating earned income, so that if you say earn $400 while on a graduated return, the insurer might take 50% of your earnings, or $200, and use that amount as the basis for calculating an LTD payment top-up. It is a benefit that helps the employee adjust to work without any financial penalty. Once you have earnings that are beyond your LTD amount, then the LTD benefits may end and you continue on with your employment earnings. There are times when employees feel they are unable medically to return to work, even gradually, or they are having trouble keeping up with their graduated work plan. So what are your options? Well, it's important to note that the insurer is having you return to work because they have determined that the medical evidence they have supports your ability to return, even gradually. In this circumstance, you are left with the responsibility of providing objective medical information to substantiate your position that you cannot try returning or that you cannot continue to ramp up with the graduated return. This could be letters or reports from your physician or other health professionals. Be mindful that the insurer will be evaluating the circumstance. Are you truly unwell, or are you unwilling to try? Therefore, you will need the support of your physician to supply the latest information to verify that you cannot continue, submit to the insurer, and see what their response is. Above all else, it is really important for you to keep track of your medical situation. My first suggestion: gather a file and keep copies of any reports or letters that you submit to your claims specialist. You might also want to keep a log of contact with the insurer, who you talked to, on what day, and what you talked about, as well as any action items that either you or the insurer are supposed to follow through on. Your physician needs to provide update reports, so it's really important that you have conversations with them. Do they think you can work? Is there any reason that the physician feels you cannot try returning to work? Does your physician have hard evidence, the concrete objective information that the insurer is seeking, or are they offering their best professional opinion? You'll want to get a sense of where you stand with your physician and how any information from your physician will be received by the insurer. And lastly, keep your own records, noting your health, your abilities, your barriers, your schedule of activities, and other health concerns. This will be important information for the discussions that will happen as you prepare to return to work. Your sleep pattern, for example, can be a very large barrier to returning to work. When you were in treatment and recovering, you might have been napping or resting during the day, and your evening sleep pattern may have become quite disrupted compared to when you were working. The best way to start is charting your sleep pattern now, kind of a baseline. You need to chart when you sleep, nap, and rest, and then you need to work on gradually modifying your sleep to reflect work. At this point, we go back to our case scenario with Nora. Her treatment is ending and she's doing well. The insurer has kept in touch, and a voc rehab counselor is assigned to the case and meets with Nora to discuss returning to work. As we discussed, the voc rehab counselor has spoken to the employer and employee, and a plan is prepared. Nora has given her input and agrees to the plan. Everything is falling into place rather smoothly. But partway through, there's a hiccup, and Nora is having some health challenges. Since she's had a good relationship with her insurer and voc rehab counselor and has been participating fully, all parties agree to a modification to the plan, and adjustments are made to give Nora a bit more time. The employer is supportive, so it's a good solution for Nora. At the beginning of this section, we said there is both a smooth transition back to work, and there are ones that are much more complicated. Let's look now at some of the worst-case scenarios. If a dispute with the insurer arises, here are some suggestions. You might want to try to resolve directly. Learn more about what they are seeking, what you need to provide in order to stay non-adversarial. What options exist for people when they have no money coming in because the insurer is no longer paying LTD benefits? You can apply for CPP disability or a provincial disability program. Some people have to look for a new job. something that is more compatible with their abilities at this time, or end up utilizing their assets. You might want to seek a lawyer to advise you of your rights and how you can work through the dispute. You might want to get a copy of the policy. That's the full legal contract between the insurer and your employer to learn of any specific details that could be of help. Your last option is either a lawsuit or a human rights complaint, but you will want to speak with a lawyer about your options and whether this is the best step. We will cover this a bit more in detail, as there are long timelines for any dispute at this level, and there are also costs and fees. Let's take a look at Nora's case if her situation were different. Rather than a smooth transition back to work, there are challenges. Her treatment is ending and she's doing okay health-wise, and a vocational rehabilitation counselor is assigned to her case. Like the majority of disputes that arise in LTD claims, the insurer has determined that Nora has the capacity to try returning to work on a gradual basis, but Nora doesn't feel well enough to work. The insurer wants to have the most current information from objective professionals beyond Nora's physician, so she is sent for 2 different assessments. Nora's physician documents her present health concerns, but the insurer has reviewed all the medical information, including the reports from the other experts that Nora saw, plus the updated report from her physician, and it is determined Nora has capacity to return. Nora feels unable, resists returning, and the insurer suspends her payment. With her LTD benefit suspended, Nora seeks legal help. Most of the lawyers in this area of law work for what is called contingency fees. What this means is that a fee agreement is established, and the lawyer only gets paid their fee if there is a favorable outcome for the client. The typical contingency fee is usually somewhere between 25 to 40% of the settlement. Disbursements, which are costs for things such as compiling medical records or paying for expert reports or consultations, may either be included as part of that settlement amount or could be in addition to that settlement amount. The lawyer will explain their opinion of the case and how they plan to take action. If Nora is in agreement, she will sign a legal contract with that lawyer, and the lawyer will file papers with the court to formally sue the insurance company. At the same time, the lawyer will start to build their case, gathering relevant documents to plan their legal approach. This will include past physician reports, the most current medical reports, and likely the 2 consultation reports from the interviews that Nora attended as required by the insurer. To beef up the medical case, the lawyer may seek an external expert as evidence for either reinstatement of Nora's LTD benefits or to try and settle the claim. The lawyer may also send Nora to see a different physician for an updated assessment. Based on the legal advice, Nora might be trying to settle for 2 years of LTD payment, but there is no guarantee she will receive that amount of settlement by the end of the case. With a typical timeline, Nora has waited well over a year for a settlement. It is also a possibility that Nora could be laid off by her employer for not returning to work. One word that is frequently used in the insurance world is compliance. Repercussions of not complying could mean the suspension of LTD payment. The best advice for someone who is in the latter stages of their LTD journey and who will be preparing for that return to work is to keep documenting your medical circumstances and keep your physician informed. Really consider just complying with the recommendations of your insurer. They have worked with hundreds of clients similar to you, and they are experts. They want you to return to work because that means you have finished that cancer journey and you can continue with the next phase of your life. Likely the most important piece of advice, consider trying their recommendations. Trying will prove concretely that either you can't do it or you can do it. We've had a deep review of the latter stages of the LTD journey. We've covered the professionals, learned about a graduated return to work, and how earnings might be calculated when someone is receiving their LTD. We discussed the importance of tracking your sleep patterns, and we explored an individual case where circumstances could play out 2 different ways. In the 5th and last section of Understanding Your LTD Benefits, we will discuss some challenges that may arise, things you need to watch out for, and offer you some more helpful suggestions for working collaboratively with your insurer. See you soon.